Hello everyone. In this post today, I would like to briefly introduce what mental disorders are and what are not to be confused with mental disorders. Before we dive into the video, I would like to provide a disclaimer. The information that I would like to share should not be considered as a substitute for seeking professional and competent authorities' intervention. Mental disorders are otherwise called as mental illnesses or psychiatric disorders. Mental disorders usually will have adverse impact on the way a person undergoes his or her emotions, the way he or she thinks, and as a result of the emotion and thinking, the person will indulge in specific behavior that will have negative outcome in his or her social, work, and family relationships. Mental disorders are diagnosed using tools such as DSM-5 and ICD-11. DSM-5 is Diagnostic and Statistical Manual of Mental Disorders version 5. ICD is International Classification of Diseases. Let's now understand a few categories and examples for various types of mental disorders. The first one is mood disorders. Depression is an example for mood disorders. The next category of mental disorders would be anxiety disorders. We have three subtypes in anxiety disorders: generalized anxiety disorder, panic disorders, and phobias. The other mental disorders categories are as follow: psychotic disorders. Schizophrenia is one good example for psychotic disorder. The next category is neurodevelopmental disorders, autism spectrum disorder, and ADHD, attention deficit hyperactivity disorder. These two are broadly categorized under neurodevelopmental disorders. The next category of disorders would be personality disorders. Personality disorders, according to DSM-5, are mainly grouped into three clusters: cluster A, cluster B, and cluster C, and there are totally 10 personality disorders. One quick example would be antisocial personality disorder. The next category is obsessive-compulsive disorders. One very widely diagnosed disorder in this category is OCD. The next category of mental disorders is trauma and stressor-related disorders. PTSD is one example that falls in this category. The next category of disorders are substance use disorders. If a person is addicted to alcohol or drugs and that triggers a person to be more disruptive in terms of his emotion, thinking, or behavior, or in terms of her emotions, thinking, and behavior, that can be categorized in substance use disorders. The last category of mental disorders is eating disorders. In eating disorders, there are two variants. The first eating disorder is anorexia nervosa, where a person would go on extreme diet to reduce the weight. The next is bulimia nervosa, where a person would indulge in overeating. And in order to reduce the weight, after realizing that the person has been indulging in overeating, the person would be resorting to vomiting method so that the weight would reduce as per his or her own intention. So these are the major categories of mental disorders. But as I said at the beginning, in order to diagnose whether a person is actually experiencing any mental disorders and his social, work, and family life is strained, The tool DSM-5 would be of paramount importance. Now, let us understand what are not to be confused with mental disorders. Temporary stress or sadness. The reason could be the loss of the loved one, or there could be some drastic event unfolding in one's life. So, an individual would have his own or her own coping mechanism. Some people will be able to rebound quickly, and some people may be taking their own time. Unless otherwise, it is drastically impacting the temporary stress, drastically impacting the individual's emotional thinking and behavior. It is absolutely normal. If a person's loved one has passed away and the individual is taking maybe 3 or 4 months, it need not be confused with mental disorder. Just because he is or she is not eating properly, sleeping properly, there is always a sense of deprivation. It's absolutely okay. The next is personality quirks or eccentric personality. Usually, a person might be a little introverted. He or she may not very easily mingle or get along well with others. This need not be attributed as something a very serious personality disorder, because each individual will have his or her own comfort zone and might take time to mingle and get along really well with others. The next is cultural or spiritual belief. Just because I do not believe in certain cultural norms or spiritual belief, I cannot outrightly conclude that the other person is delusional. The other person is kind of having a weird behavior. So this is not mental disorder. It's all about one's belief. Unless otherwise, that belief very drastically affects the person's emotions, thinking, and what is the next one? The behavior, in such a way that his social or her social work and family relationship is extremely strained. It need not be confused with any mental disorders. Low intelligence or lack of education. If someone is not well educated, at times his behavior or our behavior may not be up to what is being expected. It does not mean that the person is suffering from intense low intelligence. So unless otherwise, the person's ignorance has been extremely affecting his emotions or other emotions, thinking and behavior in a way that the family, work and social circles are extremely affected, then it need not be confused with the mental disorder. Medical condition, for example, Parkinson disease. A person suffering from such disease would have their own way of coping up. This is definitely not mental disorder. The last one is some unique personality traits. Usually, some of us would have experienced a perfectionist teacher, a perfectionist supervisor in our workplaces. Just because a person is perfectionist, he or she believes in certain idealism, it does not mean that the person is suffering from some kind of personality disorder. In this quick post today, I have highlighted what mental disorders are, the tools to diagnose mental disorders, the broad categories of mental disorders, and at the last part, I have briefly introduced those scenarios which are not to be confused with mental disorders. Thank you.